My name is Patty Aiken. I'm a registered nurse. Spent 33 years at Temple, most recently in the emergency room. As a registered nurse, I was witness to a lot of pain, a lot of suffering, and I believe that the Affordable Care Act helped a whole lot of people.
Healthcare is a human right.
Exactly. Healthcare is a human right. At Temple, we didn't take care of people on the basis of what their color was, what country they came from, their gender. We took care of them because they were a human being, and everybody deserved high quality, accessible care. I'm the president of PASNAP, the Pennsylvania Association of Staff Nurses and Allied Professionals. Hey. We are an 8,000 member union of mostly registered nurses and many allied professionals. We believe as a union that health care is a human right, and we will fight to make sure that every citizen in this country, that every person who comes through the doors is able to get accessible care, quality care. Just a point on Medicare, that's part of what's under attack as well. The plan out there in Washington is to privatize Medicare, turn it into some kind of coupon subsidy system. Sounds a lot like the Affordable Care Act that they want to get rid of in the first place. Medicare, along with Social Security, has been the single most important social program in this country that has prevented seniors from spending their lives in abject poverty and misery and eating cat food. So we will fight to save all of this health care, and we will fight to improve it. That we are right that the people of this country do not want to see us move backward on health care, but want to see us move forward. And this is one of many rallies across the country, but this is the first action by all of you, because we are circulating sign-in sheets. We will be trying to put together a coalition to fight this going forward. This change in our health care is on the fast track, and we have to be on the fast track to fight it. Are you with me? So I'm going to move to, we have some extremely distinguished guests here today. I'm really excited to introduce them. The first is Senator Robert P. Casey Jr. He may be a junior, but he's Pennsylvania's senior senator.
This fight is a fight we've just begun.
Yes, sir.
We're fighting here in Philadelphia to prevent the repeal of the Affordable Care Act. We're fighting throughout southeastern Pennsylvania. We're fighting across our country, and we're fighting across every state, and we're fighting, of course, in Washington. But there are some people in Washington, and unfortunately they're Republican members of Congress, who don't seem to get it. They don't seem to understand that we are serious about making sure that Americans have health care, whether they're children in urban areas or children in rural areas or anywhere in our country, and we're going to fight like hell for those children and those families. Let me give you an example. I was just here the other day, and we had a roundtable talking to all kinds of people about what health care meant to them. One woman who runs a small business, her name is Naomi. She's in her early 40s. Here's what she said, talking about what health care meant to her family. She said, quote, "If not for the Affordable Care Act, my son would not have a mother," unquote. These are people that are talking about not just living, but also the consequences of not having health care, which for some of them means dying. We have to make sure that we do everything possible to prevent an extreme group of Republicans in Washington, who all have health care, by the way. They all have health care. Their families have health care. The Affordable Care Act passed in 2010. What have they been doing for 7 years to find a replacement? The answer is nothing. They don't have a replacement bill. So we're going to say to those Republicans, number one, we're going to stop you from repealing the Patient Protection and Affordable Care Act. And you know what? We're getting support on this from big cities and small towns, rural areas. We're here at Temple. So many people get their health care because Temple is a hospital in the middle of a city. Temple is at risk, okay? Healthcare at Temple Hospital is at risk and throughout that whole system. It's the same story in rural areas. Rural hospitals that serve people that work on farms and work in small towns, their health care is at risk. Their children's health care at risk. Not many people know this, but 45% of rural children get their health care from Medicaid or the Children's Health Insurance Program. So we have just begun to fight. We're going to continue to fight. I appreciate what the nurses are doing, what organized labor is doing, what the mayor is doing, Congressman Brady, Congressman Evans, and the entire team. God bless you and thank you.